Hi everyone, thanks so much for having me here on the webinar, and I'm so sorry I'm not there in person. So I just wanted today though to talk through the key findings from my MPH research project, which was exploring what preconception health means to women in Wales, a cross-sectional survey. So Dr. Helen Munro was my supervisor, and who was also the clinical lead of the Women's Health Plan, and the project itself, so it's been marked, but it is currently unpublished. So if we're thinking of the context of the research project, so it was very much from the off aligned with the NHS Wales Women's Health Plan 2025 to 2035 and the preconception health objective to carry out a listening exercise to find out what preconception means to people, including healthcare professionals. So the initial rapid literature review identified that as of July 2025, there was no research in Wales that kind of focused on this topic. So that really did build the foundations of the project going forward then as well. So for our data collection, we used an online survey distributed via Qualtrics, which was cost effective, rapid, accessible, and convenient with the time period that was available to us through the MPH programme. We gained ethical approval from Cardiff University, and with this and the time frame again, it meant that we weren't able to access NHS networks to circulate the survey just because of where those boundaries lied with the approval. So the survey itself was open between April and June 2025, and it used a mix of predominantly open questions with some closed questions. And this was to try and, again, align with that idea of carrying out a listening exercise and giving the participants an opportunity to talk in their own words, to reflect in their own words on the topic. So overall, we were able to collect data from 81 participants across Wales, and they all reported that they had female reproductive organs as well. The collection was done via convenience and snowball sampling. So it meant that we kind of used our own networks, student networks, contacted organisations who work with those who are underrepresented in research as well, and no identifiable personal data was collected through the survey at all. So then looking at data analysis that took place. So for those closed questions, we used descriptive statistics and visualizations, so primarily horizontal bar charts, which you'll see. And then for the open questions, we used inductive content analysis. So this again was to find that understanding in those free text responses, and it very much works like, or runs parallel, we'll say, with thematic and conventional content analysis. So you're using an iterative coding process to analyse the data set and then identify those overarching concepts, categories, and themes from the data as well. So yeah, that was definitely a very important part of the analysis process. So then looking on and moving on to the sample that we did work with for this project. So as we can see here, the majority of participants, so 96.3% were women, and 3.7% identified as transgender. Alongside this as well, so kind of elsewhere with those closed questions, 88.9% of participants reported that their ethnicity was white, and 75.3% reported being straight and heterosexual as well. So then if we look at where our participants were based across Wales, majority were down in South East Wales where the project was based, but we did manage to get those responses from across Wales. With this data as well, so alongside it, we knew that the participants, of them 43.2% were employed full-time, 19.8% were students, and 77.8% reported that the highest level of education was a university degree as well. So then I've just gone ahead, we'll look at the ages reported by survey participants. So again, we can see here, majority were aged 30 to 34-year-old, and no one reported that they were over the age of 59 in kind of completing the survey. But with this and kind of all those kind of bits of data that I've just spoken about as well, it's really important to recognise that the sample did capture views more so from those who were white, university educated, working full time, and this is similar to the samples that were seen in research done in England as well. So away from kind of demographics, we also asked about pregnancy characteristics as well. So of the participants, it was almost an equal split of those who had and hadn't tried to become pregnant. So as you can see here, with 50.6% stating that they had been pregnant before and 46.9% had not. So within that as well, it was interesting to see that 25.9% of those participants had access to fertility support, and over a third of participants who got involved stated they wanted to be pregnant in their lifetime, but we're not currently trying. So that interest in the topic was definitely there as well with participants that replied. So then looking at our findings and our insights with this project, very much a whistle-stop tour, but absolutely my email's at the end if you want to ask any questions. So from the inductive content analysis, 2 main themes and 11 sub-themes were found as the slide shows, and these themes captured how participants broadly understood that preconception health is related to conception and pregnancy, but there were common calls and suggestions for accessible preconception health education and support throughout the life course, which is really important to acknowledge as well. So then kind of looking now into those responses we got. So when we asked about kind of the period of life that participants believe preconception health applies to, you can see here that the majority of people said it when it's someone is preparing to get pregnant and when someone is actively trying to get pregnant. There was that less kind of recognition of it being a continuous process across the life course, or it just being applicable to those who are of childbearing age as well. So within that, and then looking at the free text responses, there was very much variation regarding awareness of the term preconception health and when it should be acted on in the lifetime. So as it says there, pretty clueless about what it all entails. The overarching idea that preconception health interlinks with conception precedes pregnancy was definitely something we saw in those free text responses, with kind of that allusion to giving the best chance of a healthy pregnancy as well. So then looking at one of our other closed questions, so factors that participants believe contributed the most to preconception health. So there was very much increased recognition for factors such as diet, physical health, and smoking status impacting preconception health. Less importance was placed on those wider determinants of health. So we're thinking housing and finances, say, as well. And with those responses and kind of looking at the free text responses, there was very much an emphasis on health optimization for maternal and child benefits by acting on your preconception health. So taking steps to end pregnancy as healthy as possible. So words related to optimal, best, and maximise appeared frequently in those free text responses, and they were often linked to when participants described the ideal maternal, physical, and mental health state before conception, and then the desired outcomes as well of engaging with preconception health and fertility, conception, and pregnancy as well. So as we can see there, common factors that were spoken about included diet, exercise, weight management, and elsewhere there were factors looking at kind of sperm and egg screening, genetic testing, but there was, again, much variation in when does someone start acting. It did vary from 3 to 36 months prior to trying to conceive. So there was that opportunity to improve the current lifestyle, but variation about when this should take place. So again, we asked about where did participants source their preconception health information, and this was really interesting. So we can see majority was Google search at 44.4%, friends, social media, family, and online platforms as well. So they were definitely the front runners. So looking then at this and kind of looking at the free text responses that we had, there was that massive reliance on preconception health information that is convenient. So we're thinking about Google searches, social media, friends, people who are close by, people who've already had children, have gone through it before. Participants did discuss the want for a centralised space for preconception health information that is trustworthy and evidence-based. And as you can see, one participant there said, I would like for there to be a specific webpage available with all the relevant information I need, with some signposting to where I can access services if needed. With this too, some did mention about talking to the GP to gain advice. However, some discussed or kind of viewed GPs very much as gatekeepers to this information rather than it being, again, easily accessible. That bottom bullet point too, so when we looked through these free text responses, there was that kind of population-wide interest in this information too, and making sure that it's inclusive of partners so that it is something that's done together as part of the process too. So with this, there is an opportunity for health information that is relevant throughout the life course and for specific stages. So if we empower women's health through the ages and lifespan, they are better able to make healthier choices. Participants discussed the need for control and autonomy, and that's really important. Kind of they want to be able to make those choices and know what's available to them. But then many participants, which we found really interesting, also explored the unintended consequences of preconception health. And if we move on to the next slide, we can see what one quote said. So if you end up not being able to get pregnant when you're trying to, making life changes will seem negligible. You could become obsessed with making the right choices, and if it's still not working, you may place blame on yourself for doing the wrong things. Elsewhere as well, there was very much the cost of preconception health was discussed. So we're thinking about the financial cost, the social cost of missing out on things, professional, because the stress it might put on someone, and physical. So if you're having to change your lifestyle quite dramatically or drastically, then that can definitely have an impact too. So those implications then kind of, like I said, this is very much a whistle-stop tour, and I'm very aware that I'm slightly over the time, but the implications here then kind of taking the responses and what was said. So it was that look into an upstream, early and population-wide information on preconception health interventions. They wanted it to be evidence-based, consistent and practical information and resources for different ages, languages, levels of complexity and fertility need, such as when to start folic acid or consider smoking cessation. There was the convenience of the website, so a one-stop shop where people could go to, and also then the kind of interaction with school nurses, GPs, midwives, pharmacists, health visitors. They have the same resources, they're able to give the same information, and kind of when that making every contact count fits into, that's super important. So then also looking at support and signposting for both the intended and unintended outcomes, and making sure that support is there for the people involved. Making it accessible and inclusive so that it does involve the LGBTQI plus kind of community too, with appropriate use of terminology. So there is that learning and that ongoing recognition that actually it's really important to make sure people feel comfortable and able to talk about this topic. Engaging, so looking to social media, podcasts, videos, QR codes, posters, and then also empowering, so making sure that actually there is that choice there if people want to get involved into. And it's really important to think that preconception health is not universally the same or a definite for people, so it is, again, just making sure it's right for that person. I just put this quote at the end, so ensuring that we have choice regarding if, how, when we get pregnant. That really kind of encapsulated a lot of the thought that we're seeing there in those responses. So yeah, thank you so much. It was very much a whistle stop tour, but please feel free to drop me an email if you have any questions at all. Thank you.